All right. And thank you once again, Representative Melissa Minor Brown, for your strong advocacy work within the state and within the DHMIC. Your voice has been just invaluable. So thank you once again.
Thank you.
It's now my great pleasure to move on to a panel discussion on Black maternal health. And again, really want to feature the work that's been done in the DHMIC, the expertise we have, and all of the incredible voices that have just worked to continue to improve our maternal child health outcomes in the state of Delaware. So our panel today includes Representative Melissa Minor Brown, who I mentioned, who is a DHMIC member and chair of the Social Determinants of Health and Housing Committee and Work Group. Welcome again. Senator Marie Pinckney, who's a new member of the DHMIC and a member of the Delaware General Assembly. Tiffany Chalk, who's a DHMIC member, chair of the Well Women Committee and Black Maternal Health Group. And Marcella Lee, who is a physician here at Christiana Care, along with me, a relatively new DHMIC member. So welcome to all of you. Much appreciated. We have about 25 minutes. And if we could put up the graphic, one of the acronyms that our Black Maternal Health Group uses is STAND. And that STAND stands for Speak Up, Training, Activate and Educate Women, also for Advocacy, Not Afraid, and Different Frame of Mind. So we're going to use the STAND acronym to kind of go through our questions today and to frame our work. And we're going to start with Tiffany Chalk. And I want to start by thanking Tiffany for her strong advocacy. She can be seen all over the news the last few weeks. She's our resident celebrity. So Tiffany, let's first talk about speaking up and the importance of that and how your work in the DHMIC is framed within the need to speak up.
Thank you so much, Dr. Paul, and thank you for the nod of my new celebrity status. Thank you so much for that. So speak up, I think for me, they all resonate with me, everything that the acronym stands for, but speaking up probably resonates the most for me because I think how I got even here today, the work that I do is because I spoke up, right? I shared my story in 2006 at this here summit, the DHMIC's Maternal Health Summit. So it really gives a sense of empowerment, right? That you are speaking up, that you are taking ownership of your health and what's important to you. And I admonish all the women, especially Black women, when you're going through your maternal health journey, to speak out, advocate for yourself. Yes, it's great that you have the awesome birthing team of doulas and midwives to be there for you, but it's something that is very empowering on the inside of you when you speak out and advocate for yourself and not to be afraid to do it, right? And we want everyone to listen. And, our goal, even with our Her Story campaign, is really to empower and elevate women's voices, because a lot of times people don't listen. You know what? I could be speaking up and talking, and then you're not listening. You're not taking in what I'm saying. It could be going in one ear and out the other. When I say something's not right with my body and I'm sitting here for hours, in this triage with me and Representative Mimi just talked about yesterday, we know someone who sat 5 hours just recently in a triage and no one would listen to what they were saying that was not going right with their body. And they left the hospital no longer with child. And that happens too many times. I myself have been in those situations where you know better, you do better. And at the time I didn't know, I didn't feel empowered to speak out and advocate for myself, and ultimately led to adverse outcomes, right? So just really speaking out, because we all deserve to have the best healthcare in every situation.
Yeah, thank you. And I think clearly as a healthcare provider, we've heard this morning, and I've heard through your voices, how all of us within the healthcare system have to do a better job of listening. And as a representative of the healthcare system, I'm just going to tell you, I'm listening about listening. So, thank you.
You're welcome.
You mentioned briefly Her Story. and can maybe for people who didn't get to see it last year, can you just tell everybody in the audience a little bit about what her story is?
So her story was a video campaign that we launched last year. We worked on it for almost 18 months during COVID, where we really, again, want to elevate women's voices. And we had various women. And let me, I don't want to jump ahead, but let me say this, right? We had various women from all different social economic statuses, right? As being a part. Dr. Marsha Lee was a part of it, Representative Mimi. We had others that spanned across the state that really shared their heart and shared their stories. And it, it wasn't just pregnant women. We had Sierra. She shared she's not even pregnant, but the things that she has to think about as a young Black woman before she even gets pregnant. And I believe on the main stage it shared that, we want to take a holistic approach where we really are concerned, right? And our focus is about the whole woman before, during, and after pregnancy. So our Her Story campaign, it actually lives on our DE Thrives website, /Her Story. ABC may tell me that I'm wrong about that, but we do have that landing page, and there is a series of videos that I would encourage everyone to listen to, and just listen to the stories of women, like how they have battled with depression and postpartum depression, their hypertension during their pregnancy, how they felt like they weren't heard, right? How they felt like they were treated differently because they were a Black woman and they were an overweight, fat Black woman, right? So even the bias that comes just not with the color of your skin, but also, if you're a certain weight, you're looked at like you're unhealthy and you don't care about yourself. And that's not always the case. So please, dethrives.com /Her Story, and check out those videos. And we will continue to elevate women's voices. It is not just about the month of April. It is not just about the 1 week. It's great that awareness is brought to, and we have this 1 week to celebrate, but we're celebrating Black women and Black babies all year round. That is our goal.
Thank you. And in addition to what you mentioned, I've found it to be a great teaching tool for those of us within the healthcare system to show and discuss. And so once again, thank you for your work on bringing that forward. It's just
You're welcome.
It's a great resource.
You're welcome.
All right,
thank you.
You're welcome. Let's turn to the T for training, and I'm going to look to Dr. Marshall Ali now. Training is pretty broad. Tell us and tell the audience what you think about training and how we need to improve training in the state of Delaware.
Good morning, Dr. Paul. Thank you all so much for the opportunity to speak today on this very important panel. And training is an area that's near and dear to my heart, only because we know that there's so much more that we need to do within our workforce to improve maternal health outcomes and the care that is provided. As we've mentioned today, we all know that racial disparities exist, and not only maternal health outcomes, but also the treatment that is provided. In order to reduce these disparities, it's important that we recognize urgent maternal warning signs and provide timely treatment and quality care for all patients. As we mentioned today, Black women are 3 to 4 times as likely to die from pregnancy-related deaths, and this is attributable to many factors, which include variation in quality care, chronic disease disparities, social determinants of health, structural racism, and implicit bias. Yes, doctors can be biased. Yes, medical providers can be biased. And medical providers have a long way to go to improve the care that we provide and ensure that we overcome biases and stereotypes that can impact the care that we provide. We know that in many realms, studies have shown that Black patients are often prescribed less pain medication than white patients who present with exactly the same complaints. And Black patients with signs of heart problems get referral for advanced cardiovascular procedures less often than white patients. And this is not okay. In the past several years, there has been much focus placed on the benefits of bias training, which has been utilized and legalized and legislated by many states and required by medical providers. These trainings are beneficial because they help providers understand how even well-meaning providers and responses to patients can inadvertently cause harm and even death. Perhaps most importantly, the most important part of this training is to help providers understand that what patients of color, especially Black women, Black patients who suffer disproportionately, already know, that bias and racism are embedded in healthcare and what we can do to overcome those biases and stereotypes that many of us harbor just because we are human. Bias training typically starts with the provider or taking some type of implicit bias association test, which measures automatic associations between people. And these can be based upon not just the biases on race, but also religion, ethnicity, and even what Tiffany mentioned earlier, sometimes providers have different biases based on the shape of patients. These results can be stunning, particularly for providers who think that they are unbiased. And so implicit bias training is an important part of what must be a larger strategy in recognizing bias and addressing bias in healthcare. But on its own, it would not change maternal health disparities. And so bias training in part, in addition to metrics that measure outcomes and ensure that providers are providing the best evidence medical care to patients are necessary to address maternal health outcomes.
Thank you. So you talked about bias training, and I think I heard the two speakers echo the same thing that you said this morning. It's a start, and I think we all recognize biases. Hopefully nobody comes to work every day wanting to be biased, but as you mentioned, we are all human and we all have biases. And I look at the journey to equity and bias like the journey to quality and safety. I mean, we have to come to work every day trying to improve. And it's going to be a long journey. So any training, as you pointed out, is just the beginning. It's something that we have to look at for the long run. So thank you. So let's now turn to the A for advocate. And we've already heard some of the great work from Melissa Minor-Brown, Representative Melissa Minor-Brown, advocating in the state of Delaware. Tell us a little bit about your work and how you're further advocating in the state of Delaware to make changes to improve maternal child health outcomes in Delaware.
Absolutely, Dr. Paul. And you know what? I want to start with the great work that's happening on the Delaware Healthy Mom and Infant Consortium, because all of us are a part of that. And as for myself, I chair, along with Rita Landgraf, the Social Determinants of Health Working Group. And we are working on an amazing pilot specific to homeless pregnant women, which will provide housing and wraparound services and financial literacy and just unpacking that backpack gently with a holistic approach to begin to look at the barriers that exist. So that will in turn improve our infant and maternal mortality rate, just having that support around those women. So I'm really excited, and I know Rita Landgraf is really excited to get this rolling. Also, I chair with Tina Andrews, the doula ad hoc working group, and we are meeting to just look at how we can support doulas in our state, and also how we can support women and ensure that every woman has access to a doula. So that there's work that we're doing there. And we know that literature proves that Black women have better outcomes when a doula is involved in their care throughout pregnancy and childbirth. So that's really important. On the legislative side, I just filed the 2022 Delaware Momnibus, in which Senator Pinckney is my co-prime on almost every bill. In this series. So it's a series of 7 bills created to improving maternal health disparities in our state. And just to go over some of those bills, one is to ensure that hospitals and birthing centers are providing annual evidence-based implicit bias training for all hospital staff, not just in labor and delivery, not just the healthcare professionals, but even the person that sits at the front desk, even the person that comes in and changes your linens. So that's really important, because we know how your experience starts the minute you walk into the facility. So we want to make sure that everybody is on board with that and able to understand the biases that could possibly exist. Also, House Bill 234, which expands Medicaid coverage to 1 year postpartum. Another bill, we're looking at how we can support pregnant and postpartum women who are receiving TANF, which is temporary assistance for needy families, so that they can utilize educational modules and parenting support groups, lactation groups, and child development, versus being required to go out and seek employment during that time. Because when you're receiving TANF, you have to show that you are out seeking employment every week. So this would take the place of that, and it's going to be very educational. Parents can join support groups, join lactation groups, join parenting, look at parenting modules and all that great stuff. because with 10, if you can request an exemption, but you're only available to 12 months over a lifetime. So we need to look at how we are supporting our pregnant moms, postpartum moms. Another bill tasks DMMA, which is Delaware Medicaid, to provide a plan to the General Assembly in November 2022 on how they plan to reimburse doulas through Medicaid. We're also making some changes to the MMRC, Maternal Mortality Review Commission, or committee, consortium commission, all confused, but basically to increase the transparency and the diversity. And we would include a member from the community, also a midwife or a doula, and also tasking them to hold public sessions to discuss their findings and allow for community input. Then there's some legislation within the Department of Corrections. So the Department of Corrections will create a midwifery and doula program, in which they are very excited about. So we're having these conversations frequently on what this program is going to look like, and also how we can ensure that some of the women who are under their supervision can not only, the pregnant women to have access to a doula and a midwife, but also the women who are under their supervision who aren't pregnant, how they can get certified as doulas as well. Also expanding restrictions on shackling to include women who are in their second and third trimester. Right now, you cannot shackle a woman who is in the birthing process and in labor, but we want to make sure that we are not shackling pregnant women within the second and third trimester and within 13 weeks postpartum. And then under the African American Task Force, I actually chair with Rep. Johnson the Health and Welfare Subcommittee. And we are looking at, we actually recommended that we look at how we can allocate 30% of the maternal health funding towards Black maternal health initiatives, and to continue that until the disparity no longer exists. So that's what we're doing on the state level. And then with the advocacy piece, Tiffany and I, along with Dr. Lee and Senator Pinckney and April Lyons, we've just been continuing the conversation in the community with interviewing women, social media posts, educating women. And we just want women to know that you can be your own advocate. It's okay to get a second or third or fourth opinion. Don't second guess yourself if something seems unsettling, but ask many questions to your provider when you go to your visits. Create a relationship with your doctor by enrolling in your care. Interview your doctor. We talk to women about interviewing their doctors. Ask how many Black patients they've provided care to and how many have experienced adverse situations. Also ask them what they know about the Black maternal mortality rate. And one thing we tell women is it's okay to fire your doctor. It's okay to fire your doctor and find another one. And also, in reminding women to make sure you're attending to your self-care needs during pregnancy and postpartum. This isn't the time to overwork yourself. Make sure you're delegating your tasks to others, listening to your body and doing your research. And then with community advocacy, we just need to continue the conversation. We want women to continue to share their stories and know that we want them at the table because everyone's voice matters. And this isn't a time to be silent. It's a time to get louder about the change that you would like to see. And like Tiffany said, we're going to continue having these conversations. We're going to continue having them until the disparity no longer exists.
That's great. Doesn't sound like you've been very busy. But if I could we don't have that much more time, but just a really quick answer. How do you think the recent legislation to expand paid parental leave will help maternal child health?
That's an important piece of legislation. Absolutely. Women, let me tell you something. I think about my own experience. Because of this bill, I actually want to have another child, Dr. Paul, because I want to know what it feels like to be able to spend time with your newborn baby and continue nursing your newborn baby beyond 6 weeks. Because the hardest thing in the world is to drop your newborn off at a daycare center with complete strangers at 6 weeks old, and then go to work and expect yourself to put on a happy face and be able to really carry out your job duties. It's impossible. And it has such a strain on your mental health. So I'm excited about this bill. I can't wait to get it passed. I think we just got it passed. But we still need to do more work around this legislation to ensure that moms and dads are covered and to ensure that every person who was postpartum in our state who is working, who has a full-time job, is eligible to receive this paid parental leave, because and it's important for dads too, for bonding. You know, you look at early intervention. This is the beginning to early intervention when it comes to the adverse childhood experiences that our kids experience in childhood and then leading into adulthood. So important. And I'm excited to be one of the sponsors on the bill. And I know Senator Pinckney is as well.
Yeah, thank you. And let me just add that there's good evidence that similar bills throughout the country have reduced infant mortality rates. So really important work. All right, let's now turn to N for Not Afraid, and Senator Marie Pinckney, thank you. Can you just explain to the panel and to the audience what Not Afraid means to you and why that's important?
Hello, thank you so much for such a great question, David. I am going to challenge it just a little bit, though, because that's who I am as a person. I think the idea of being not afraid is interesting and also challenging, particularly when we just heard from people like Tiffany, who told us about someone spending 5 hours in the hospital and coming home without a baby. Particularly when we heard from Dr. Lee telling us that there are doctors who knowingly or who unknowingly, hopefully, and possibly knowingly have biases that inform the way that they practice. When we heard from Representative Minor Brown that it's okay to fire your doctors, those are not things that you can do and not have some kind of fear or be some kind of afraid when you're taking action against them. But what I think is more important is honoring and acknowledging that these things are fearful, that these things are hard, these things are difficult, and then operating anyway, not operating out of fear, not allowing your fear to immobilize you from taking action on what is quite honestly life and death situations. And so I don't think that it's possible for us to expect women and birthing parents to not be afraid, but I think that it's more important for us to encourage them to have communities around them, for us to be the communities around them that create avenues and opportunities for them to move anyway, despite the fear. Because giving birth, bringing healthy children into the world, it is in and of itself one of the scariest things that you can do, while it's also one of the most beautiful and most important and life-sustaining things that we can do. And so for us to expect families to not be afraid, I think is putting too much on them. But it is up to us to build healthy communities and healthy partnerships where families can have someone that provides strength and sustainability for them. So when we support organizations like DHMIC, when we support organizations like Black Mothers in Power, when we create avenues to have providers of color, when we make sure that women know that they have the right to have doulas and that they have the right to use their voice, then we can move to a place of not fear, because we're telling people that even though you're afraid, that fear does not have to immobilize you. Representative Minor Brown is one of my closest friends, so she's going to be familiar with what I'm about to read, but I would also be me if I didn't bring a book into a conversation somehow. And interestingly enough, I am reading Sister Outsider by Audre Lorde, which has been just a phenomenal book. And if it's okay, I just want to share just a little piece because it's really relevant to what we're talking about here. And this comes from her essay, The Transformation of Silence into Language and Action, which was written actually in the 70s. And I'm just going to read just a quick little paragraph from it. But we all hurt in so many different ways all the time, and pain will either change or end. Death, on the other hand, is the final silence, and that might be coming quickly now, without regard for whether I have ever spoken what needed to be said or had only betrayed myself into small silences, while I planned someday to speak or waited for someone else's words. And I began to recognize a source of power within myself that comes from the knowledge that while it is most desirable not to be afraid, learning to put fear into a perspective gave me a great strength. And that's from Sister Outsider by Audre Lorde. And I think it's just a good reminder that fear is there, fear is real, fear is telling us to pay attention to something, but fear does not have to immobilize us. And that even though we are afraid, even though there are dangerous and scary situations, if we have communities around us, if we have people that support us around us, we can still do the thing.
Thank you. And I think that's the concept of allostatic load. In a sense, a little bit of stress is good. It motivates you. A little bit of fear is good, but too much fear is bad. And so again, really appreciate that perspective. And so we have 1 minute. We're going to go really rapid fire responses here on different frame of mind. And so we'll go back to Tiffany, really quick response. What does that mean to you?
Yeah, I just think it means that you got to think differently, right? I think I said earlier, when you know better, you got to do better, and break the motto: if it ain't broke, don't fix it. It's broke, guys. It's broke, and we need to fix it.
Okay, Dr. Lee.
Different frame of mind. Don't feel like health providers are being targeted, but we need to treat maternal mortality like we would any other health outcome or quality initiative, and use our best practices to address the disparities that exist.
Okay, thank you. Representative Minor Brown.
I'm going to say this as quick as I can, but for me, it's all about taking that holistic approach to how you provide healthcare. There was a patient that was prescribed an inhaler, and he was labeled non-compliant because he wasn't using his inhaler. And it only took a few minutes for an occupational therapist to ask him to use his inhaler, and found out that he had a restriction in his fingers that did not allow him to depress the inhaler. So a different frame of mind is being able to take a holistic approach at your patients and looking at their whole well-being, where they work, live, play, and access to resources, and being able to wrap your arms around them and provide them what they need and help them reach those resources that they need to be successful.
Thank you. And finally, Senator Pinckney, different frame of mind.
It's going to be very similar to my friend, Representative Minor Brown, who is always in my brain that it is not always the responsibility of the patients and the people that we care for to change systems. That is the responsibility of the system itself and the people who uphold the system to provide care in a way that is accessible to all people of all cultural backgrounds, differences of thought, and that we need to stop putting that responsibility on particularly minoritized, underrepresented Black and Brown communities to be the ones to make change when they are supposed to be utilizing systems that work for them. We need to take the responsibility of creating systems that work for everyone.
Thank you. In the words of David Williams, we heard this morning, I think we can all stand up and be a ripple of hope. So thank you. I agree with that. We are on time. Thank you to the panel members for your really thoughtful and just really robust responses. It's greatly appreciated. And again, thank you for everybody for your work within the state of Delaware and within the DHMIC. We are now at the point of the program. We are going to go to the Community Thrives breakout session from 11:30 to 12. So before we send everybody away, be back at 12 for lunch with our DPH director. That's going to be really exciting, and followed by the Kitty Esterly Health Equity Awards. If you look on your, to access the breakout sessions, it should be on the right-hand side of the event display under community breakouts. And if anybody's having technical difficulties, there was a number given earlier in the chat. With that, enjoy the community breakout sessions. We will see everybody back at 12 o'clock. Thank you.